Hi everyone, this is Dr. Bryan Wang from Orthopaedics. I am an orthopedic specialist with an interest in sports injuries of the shoulder, elbow and knee. Today I'll be speaking a little bit about golfer's elbow.
What are the most common elbow injuries you see, and their typical causes?
As an elbow specialist, I see a wide spectrum of elbow injuries. In the young age group, the elbow injuries typically are related to sports or overuse injuries, or sometimes I see patients with high energy trauma resulting in elbow dislocations or complex elbow fracture dislocations. In the slightly older age group, what is perhaps more common are injuries related to wear and tear or degeneration like arthritis.
What preventive measures do you recommend for those at risk of golfer's elbow?
Okay, I think the first thing that's very important is before any activity or sports, it is really important to do some warming up and stretching activities. This improves the flexibility. I think the other thing that's very important is you want to make sure that you have a proper form and a proper technique when doing your sports. And I think sometimes it might be very helpful, especially when you're starting out, to get the appropriate training or advice from professionals. The other thing that is important also is to make sure that there's some strengthening before you do any of the activities. Also help to reduce strain on the insertion of the tendons which lead to golfer's elbow. And finally, I think the other thing that is very often neglected is the use of correct equipment. So sometimes when you're using equipment that might be too big or too heavy for you, this can result in an increased risk of developing pain of golfer's elbow.